There is currently a statewide outbreak of syphilis in Arizona. Reporter Taniyah Williamson found out ways that medical professionals are working to keep the disease from spreading.
The state of Arizona is currently facing an outbreak of syphilis. The sexually transmitted disease can be treated, but oftentimes can go unnoticed by those who have it.
It is known as the great imitator, and a lot of times people may not even know or have signs that they're infected at certain times during the infection. That's why it's really important for them to have those conversations with their healthcare provider so that they can be tested for STDs when it's appropriate and at regular intervals.
Since January of this year, the Department of Health Services says more than 600 cases of women having syphilis have been recorded. Women who are pregnant run the risk of passing the disease to their babies.
What was also concerning is the number of babies that were being born infected with syphilis. We had over 100% increase from last year in the number of deaths. We've had over 40 cases of congenital syphilis, and 8 of those have died. Compared to the numbers that we saw last year, that is a vast increase.
The Arizona Department of Health Services recommends that people use condoms during every sexual encounter, reduce their number of sexual partners, and to get tested regularly for STDs.
Having those candid conversations with their healthcare providers and making sure that if they do identify an infection and they receive treatment, to complete treatment.
In Phoenix, Taniyah Williamson, Cronkite News.
Early detection and treatment can be extremely helpful in preventing lifelong health problems and death.